And now we have Terminator with us, Dr. Rajendra PRASAD from New Delhi. He is a very, very well-known innovator and invented so many things. Today is going to speak on while chopping when the cataract doesn't crack, what to do. Dr. Rajendra PRASAD, over to you.
Thank you very much, Dr. Vinod, and good morning, everybody. And it's nice to see a lot of people in this early morning here in this session. And we have seen a lot of speakers, our eminent speakers have spoken already.
Meanwhile,
I'm just going to talk on a very, very hard cataract, rock hard cataract, how to manage these rock hard cataract when you don't get the crack in the hard cataract.
Meanwhile, we can have a question to Dr. Sudhang Bharti. Dr. Bharti, do you increase the energy while you're doing femtonoarchic cases?
No.
It's the same energy level?
It is the same energy level. I don't think we need to increase that actually increases the turbulence.
Okay. Yeah. Thank you. So, over to you, Dr. Rajendra.
Okay. So we all come across these rock hard cataract in our clinical practice, and we know that there are a series of specific and difficult challenges when we deal with these hard cataract in terms of density of the nucleus, weak capsular bag, absence of the cortico-epinuclear buffer behind the nucleus, and the nucleus generally sits on the very fragile capsule, directly sits on, and then the chopping becomes very difficult. We use many techniques to deal with these hard cataract, but quite often when we try to chop these hard cataract, we don't get the crack in these lenses. And when you don't get the crack, then you are left with the undivided nucleus. What happened?
Okay. Okay.
It's opening other files actually.
Okay.
उनका हो गया
Is this the last one?
Sorry. Okay. So as you can see here, like many of these hard nuclei, you don't get the crack, and if you don't get the crack, then you are left with the undivided nucleus, and then the manipulation becomes too much because you have to taking out these pieces on the phaco probe becomes very difficult. So you have to use a lot of second instrument, and that is the time like you may get into the problem of capsule, cornea, and so many things. So I'll just take you through this very hard cataract, the simple management, what are the points you should remember when you're dealing with the hard cataract. Your pre-operative examination is very important because you should know that what is the case you are dealing with in your OT, and unless you see the case properly, because you have in terms of the capsular status, pseudo exfoliation, the hardness of the nucleus, the dilation of the pupil, all these points are very important because you have to have a very large dilated pupil, and during the surgery you must stain the capsule so that you get a large capsular axis, because always aim for the capsular axis of at least 5.5 to 6 millimeter in these cases, not less than that if you have to manipulate these hard nuclei. So what I'm trying to do here is I'm trying to get a 6 millimeter of pupil capsular axis, and your hydro procedures should be very limited. Don't use too much of the fluid. Don't inject too much of fluid. Many times there is an adhesion of the nucleus with the posterior capsule, and you may blow out the posterior capsule. Rotation of the nucleus is another important point. You must make sure that your nucleus is free in the capsular bag, because if you are doing the chopping, your nucleus has to be free. And then the important point is your chopper is also very important. I'll let you know about the chopper. And then you have different techniques to use, because you can use a direct chop, you can use divide and conquer, and so many other techniques are there. What I'm going to show here is the terminal chop technique, which is very simple and very effective in these hard cataract. And as you can see here, because I'm trying to crack the nucleus from the equator, this is how you get a complete division of the nucleus into two pieces, as you can see here, because without too much of manipulation, you have it now two complete segment. Then you can hold the first segment and divide it further. But as you can see, because I'm going all around the equator of the nucleus, not the equator of the capsular bag, it is the equator of the nucleus, which is, I'll explain you a little later. And then you start the emulsification of the nucleus. And this is the second half, as you can see here, because hold it with the phaco probe, divide it into two, and then start the emulsification. So what I said was the most important is the cracker. The cracker is very important. What I'm going to show here is this is the terminator. We call it as terminator. As you can see, the shape of the terminator is a little different from the other choppers. It has a blunt tip. It's a round and blunt tip, because when you are hooking the nucleus, you are not hitting even if you hit the posterior capsule, it's not going to threaten the posterior capsule in any way. And then it has a wedge shaped. There is an inner wedge, internal wedge. As you can see here, internal wedge, like it's a wedge. It's like a chisel, not like a normal cracker, which is flat and sharp. It's a wedged cracker. And then when you use this wedge cracker, as you can see here in this, so just hold the nucleus at the center, and you have to go around the nucleus, just draw the nucleus around the nucleus, and when you bring it and you see the crack has already happened. You don't have to bring it to the center of the nucleus and don't have to cut the nucleus. You are just cracking the nucleus at the equator, and this crack actually, which happens at the equator, it transverses to the center, and you get a complete splitting of the nucleus. Like if you have a block of glass block, if you crack it from the equator, you get a complete cracking. This is what happens with this cracker, and you can see these are another cases, and where you have a very, very hard nucleus. I'm just trying to hold it at the just within the equator, just slightly draw it, go around, hook it, and then see the crack happens here at the equator. And this, then you have to slightly split it, and you get a complete cracking of the nucleus, full thickness cracking. This is another case, very, very hard nucleus. Just hold it. You have to look at the phaco probe where I'm keeping it. I'm not going very deep towards the posterior pole of the nucleus. It's slightly towards the equator. Hold it and then crack it here, and then split it. And when you split it, you get a complete two segments. And this is another case. You can see this is a grade 6, grade 7 nucleus, which is absolutely cataract and nigra, which we call it. Otherwise, normally it becomes very difficult to cut, chop, or do anything with this cataract. Even making a trench becomes very difficult. But as you can see, with this cracker, you can crack this kind of the nucleus also. You just held and you have splitted the nucleus into two. Now you are taking the first, and see the division of the nucleus, as if you have done a femto division of the nucleus, because you get a sharp cut. It's not a cut actually, it's just sharp crack. Any hard object, when you're cracking, it cracks into two completely. This is what is happening with this device. This will happen only with this device because it has a wedge, inner edge, and this wedge actually acts as a cracker, and you can complete the surgery in this kind of cataract. Otherwise, normally you would require ECC or MSICS in these cases. But here with this device, you can see like even this kind of the nucleus also you can crack, and you can emulsify very simply, and you can see the pristine clear cornea on the next day itself. And this is another case, very hard cataract. And look at the phaco probe. This is very important. The phaco probe, you have to penetrate not towards the posterior pole, slightly towards the equator, then hold it, draw it a bit, and then crack here, because cracking has to happen at the equator only. Then only you get a complete splitting of the nucleus. This is another floating cataract, absolutely hard. Normally nothing will work in this way. You can't do horizontal chop or vertical chop in these cases. But here you can do the terminal chop technique. Just hold this from the center, go around it, and then crack it. You must be doing this technique many a times, but this is, if you use this device, then you can have a much better cracking of these nucleus also, and you can very simply complete the surgery. And this is, I'll just show you this animation, because you look at the position of the phaco probe. You are penetrating from the center and holding it at just within the equator. And this is, then once you hold it, slightly tilt it and draw it. Then only, because you have to see the edge of the nucleus. Don't go blindly like we go in the horizontal chop. In horizontal chop, we go blindly towards the equator and then you hit the posterior capsule. Here you don't go blindly. You have to draw the nucleus and see the edge, then only hook it. After seeing the nucleus, then hook it. This is what is happening, and then crack happens at the equator, and this crack, this is how you hook it, and then this crack goes to the periphery, and you get a complete cracking. So thank you very much for the nice hearing. Thank you.
Thank you very much, Dr. Rajendra. And we have another 3-4 minutes for a quick 1 or 2 questions if you want to have.